So as I come to the end of my term as your Dean, it seems timely to reflect on the faculty's progress towards achieving the ambitious goals that the board set in 2018 for the 5 years through to 2022. I believe the faculty is well on track. Much of this success has been due to the relationship building over the last 2 years. Highlights have included visiting several state health ministers and their advisors to advocate for pain services, touring Australia to connect with all of our regional committees, and a trip to New Zealand, catching up with the faculty's national committee there and meeting Health Minister Clark. The faculty has worked more closely with the Australian Government and our key partners, the Australian Pain Society and Pain Australia, on developing the National Strategic Action Plan for Pain Management. The faculty held a workshop in February to follow up on that plan and look at delivery of the goals of the plan. In New Zealand, the launch of the SAPER report on the cost of pain in New Zealand led to meetings with multiple key stakeholders there, and this work is ongoing. In Australia, again, the Therapeutic Goods Administration now views the faculty as one of its trusted advisors, especially on the current hot issue of opioids in chronic non-cancer pain. Internationally, the faculty, along with the college, has reached out to our colleagues in Hong Kong to support them during the difficult times they face there and to build on the faculty's already strong relationship with them. Internally, a lot of work has gone on to strengthen the faculty's relationship with the college. The merger of our two separate strategic plans has resulted in a stronger, unified plan with improved visibility and priority of the faculty's goals. In addition, the Dean is now a member of the College Executive Committee and the Vice Dean a member of the Finance and Risk Management Committee, enabling better engagement across all college business. Meanwhile, the faculty's educational offerings have been updated and improved, focused mostly on the curriculum with resources for the training program and making the Better Pain Management program available for an international audience. These are just a few of the activities that the faculty has been engaging with over this last 2 years. We've started some new projects as well, and all of these need to continue as the faculty strives to maintain excellence in pain medicine, education and clinical practice. I'm confident that the faculty is growing stronger with each year, and it will continue to serve the community and lead the world in pain medicine well into the future under the leadership of Associate Professor Michael Vagg. It has been an honour and a privilege to serve the faculty for the last 2 years as your Dean, and now it is my pleasure to hand over to Michael as he takes on the role of Dean.
Thank you, Meredith. It's an enormous privilege to accept the handover from you. The last 2 years has been a time of huge challenge and change for the faculty. And as some of the contributions that you've made may not bear fruit immediately, I'd like to take this opportunity to pay tribute to the job that you've done on behalf of myself, the board and the fellowship for the outstanding contribution that you've made. For those who have not met me before, my background outside of pain medicine is in rehabilitation medicine. And the last Dean with a fellowship of the Australasian Faculty of Rehabilitation Medicine left office in 2006, which was around about the time when I was trying to finish my case report and get that handed in so that I could get my letters. I am also the first Dean who has gone through the full training program from start to finish, including the examination and all components. So in many ways, this is a changing of the guard and a generational change for the faculty. When I began training in Geelong in 2004, it was the only place in Victoria that you could actually go to train in pain medicine. I was coming into the specialty at a time when there was a scoping project underway that the faculty was in the process of doing, where it was part of specialty recognition for the AMC, and they were trying to define what the identity and the scope of practice of pain medicine doctors was. I thought it was odd that I was being asked as a trainee, what did I think a pain specialist did? I thought it was obvious. I thought we were here to help people with acute, chronic and cancer pain and, to make their lives better. It turns out that I was a bit naive and I didn't really appreciate the breadth and the scope of the uniqueness of the vision of the early pioneers of the faculty. Like many a second generation family member, I just took all that hard-won progress as a given. And I thought maybe that things were settled and there wasn't a lot left to fight for professionally. It's safe to say I probably know a bit better now. On reflection, choosing to be involved in pain medicine is a strange way to make a living. The proposition is preposterous. We're trying to manage a whole life problem, that not just a medical problem, that affects nearly 20% of the population of Australia and New Zealand. And we're trying to do this with an active fellowship of just a few hundred fellows. The entity with which we're doing battle depends for its outcomes largely on psychological and social factors within the patient's world that are not really within our control. And there are those in society who think that maybe social and psychological factors are not really what doctors should be trying to involve themselves in. The best drugs we have only work about a quarter of the time, and we haven't had any really amazing new treatments come along in probably the last 20 years, despite an explosion of basic science and much improved understanding of our field. So why do we do it? Well, we're specialist doctors, and we don't stop being specialist doctors just because some people think there's a limitation to the medical role. We continue to explain ourselves every day to our colleagues and to our patients. We justify our clinical existence every time a new hospital administrator comes along or a new case manager takes over one of our compensable patients. We politely endure the professional misunderstandings of our colleagues, and we try not to look wounded when our well thought out expert advice is immediately supplanted in the patient's mind by a Facebook celebrity chef or by a white-coated supplement salesperson down at the shopping centre. We do this because we're committed to looking after the health of people who have acute, chronic and cancer pain, and this is the only way we know how to do it best. It is a strange way to make a living, but it's the one that we've chosen. And the slings and arrows don't really trouble us because we know deep down that we want to be the one who makes a difference to this person's life when so many others have not been able to. Pain medicine is a noble endeavour, mixing art and science of medicine in the best traditions of our intellectual humanistic tradition. I'm certainly proud to be taking my turn as the steward of this particular specialty over the next couple of years. But I will be taking office at a strange time in the faculty's life. All of the functions of the college are now being performed remotely, and the beautiful mahogany doors of Ulamaroa are closed. They say that the heaviest pressure produces the brightest diamonds, and I'd like to draw attention to a couple of diamonds that have been created in the pressure of the last few months. The acting general manager of the faculty, Juliet Whittington, and the CEO of the college, Nigel Fidgen, have overseen a transition to the current version of business as usual with extraordinary professionalism and superb judgment. It's fair to say that organisations large and small have not seen a challenge like this, maybe since the Second World War, maybe even longer ago than that. And I think the fellowship owes an enormous debt of gratitude to our staff for keeping the virtual doors open, even if the real ones are shut and we don't know when they're opening again. In closing, I would just like to thank the board, the leadership group of the faculty for entrusting me with this role for the next couple of years. And I will certainly try to repay the faith that's been shown in me to the absolute best of my ability. To the fellowship, I look forward to the time when I can meet everyone in person at regional committees, at the New Zealand National Committee, at the ASM, the annual symposium, the spring meeting, the Australian New Zealand Pain Society functions, and most of all informally around the traps. Until it's possible to do that in person, I wish you all good health and safety, and I hope everyone stays sane in the next little while.